Thank you so much. It's great to be here at the Connected Health Conference. And for those of you that have been here today, you may have been feeling that there's some energy on the floor. I feel like all of us maybe believe that we're on the cusp of something, perhaps a transition or a transformation. That's kind of what we want to talk about over the next 30 minutes. As you heard, I'm Jonathan. I'm with Intel. And despite Intel being a technology company, this talk is not really about technology at all. In fact, what I'd like us to do is begin a dialogue. And it's a conversation that I think everyone in this industry needs to participate in. And really, the time is now to have these discussions. And where things like technology may have appeared to be barriers in the past, they no longer are. And so we're really not going to spend that much time talking about them, but rather, as you heard in the video, talk about some of the other barriers that currently are in the way that have historically prohibited us from taking advantage of some disruptive opportunities. As you heard, economics is a key issue or a key barrier, or has been. Looking for proven ROI in remote patient monitoring applications, as well as on the provider side, are the right incentives in place? I think right now we face perhaps penalties, but can we create an economic model that actually rewards the provider for taking advantage of these use cases? Of course, behavior has been an issue in the healthcare industry for a long time. It's not just about the behavior of patients and their willingness and adoption of these new technologies, but also the behavior and the culture of the industry itself in being open to change and open to transparency and other things. Of course, the patient experience is super important in that, and having technology that is easy to use for any age group, that protects their privacy and keeps their data secure is, of course, paramount. And lastly, it's about access. Access to the technology, certainly, but access to the care providers, access to connectivity, and access to all of those security features. And of course, if it was easy, we would have been doing it by now, because we've been talking about it for a long time. And what I thought I would do is share with you why I'm optimistic and tell you a personal story. It seems like whenever we're at these types of events, people like to tug at some heartstrings and talk about their own personal health-related issue. And with 850 million people on the planet with at least one chronic condition, I think everyone here has those stories. And so rather than tell you, a story about my father's diabetes or my mother's, two battles with cancer, I thought I'd tell you maybe a local story, which goes back about 25 years when I started my career. I had just finished working on my master's in health, and my first job was just across the Charles River at a company called Cambridge Technology Partners. And I thought it would be really interesting to start my career focusing on technology applied to healthcare, because it seemed like it was a great opportunity to create some disruption in that industry. And after a couple of years, I got really frustrated because the healthcare industry and my personality just weren't really meshing, because I'm hyper impatient. And the pace of change in the industry at that time was too slow, and I got frustrated. And so I moved to Silicon Valley, and I started working at companies like Cisco, which, in Silicon Valley, it's like the carpool lane for innovation. We don't slow down. We bring other companies on the ride with us, and we move really quickly. And that was a great fit for someone in their 20s who's starting out in their career. And what I learned at Cisco is the value of a network. And not to geek out on you too much, but there's a rule called Metcalfe's Law, which is that when you add a node to a network, you increase its value exponentially. And so that was a powerful lesson. And since that time, I've moved to companies like GE and Intel. I really understood the value, not just of the network effect, but of the data and the value of large volumes of data and what that can do in terms of deriving insight into how our environment operates and how we can get better outcomes from physical infrastructure or even, in this case, our health. So what we do at Intel is we really focus on how do we apply technology to transformations. And in the area of remote care, we're actually seeing that we're approaching a tipping point. So we've been talking about this for a couple of decades, and we're seeing real results. We're now over 7 million people are being actively monitored through remote patient systems, which is a 44% growth in the industry. And so what this is it's innovation and access to data that's happening outside of a traditional hospital environment. And that shift is not only having a huge economic impact on care providers and insurers, but it's having a profound impact on the health outcome of patients. And if you're not aware, for the people that perhaps aren't healthcare professionals in the room, 1 out of 5 times a patient that's admitted to a medical center for treatment of some chronic condition is readmitted within 30 days of being discharged. And that not only creates a really bad health outcome for that patient, it also is incredibly inefficient and expensive. And so the opportunity to have a continuous monitoring of patients with chronic conditions outside of a traditional medical center can make a huge impact. In fact, what we've seen over the last couple of years in looking at patient readmission is that you actually have the ability to reduce patient readmission by as much as 75%, which in financial terms is up to $150,000 per year per patient. So whether your priority is cost savings or it's readmission rates or it's reducing admissions to begin with or focusing on mortality or disease markers or any other costly episodes, this shift is really creating a bend in the value curve and creating transformational outcomes. So I said I wasn't going to talk about technology, and I'm really not, but I do want to emphasize that Intel has really been at the foundation of a lot of industry transitions and market disruptions. And we've seen this, of course, over the last several decades in markets like financial services and in retail and media. And more recently, we're seeing it in areas like the cloud and autonomous driving. And so we've learned a few things over the years. And one thing that is clear in all of these transitions is that it's rarely about the technology. It's usually about the business models and the workflows and culture and skill sets and these types of things that all need to conspire together in order to drive change. And it's during that period of time that we've learned that the value of data and tapping into digital transformation, many industries have gone through this before. Healthcare is not the first, it's certainly not the last, but the opportunity is happening now. We've seen it in medical records, we've seen it in image analytics and omics. In fact, some of the work that we've done with the Broad Institute over the last few years has enabled us to get 5 times the amount of data processing at 1/3 of the price. We're seeing data being used every day to influence decision making so that we're making more data-driven decisions rather than a guessing game, as well as access to large volumes of patient population data, which allow us to derive insights that perhaps an individual provider was unable to understand in the past. And a lot of these inflections are happening because of the advent of remote care. And we really think that we're at an inflection point. The inflection point is not the technology, but it's the economics, the access, the culture, and the behaviors all coming together. And honestly, at least from our point of view, we think this is probably the single largest change the healthcare industry has seen since the creation of the monolithic institutional hospital in the 1800s. It has that much of a profound impact on how we can deliver care and derive outcomes. So we have a choice. we can take the hard path of making the change, or we can take the comfort zone path of maintaining our inefficient and expensive ways. And so what I thought I'd do is invite the architect and world's most authority on inflection points to join me up on stage so we could talk about what this means. So I'd like to introduce Clayton Christensen, who's here. Here he is, Dr. Christensen.
Good to see you, John.
Good to see you. I would never have guessed that Nirvana was going to be your walk-up song. That's awesome. I want to thank you for joining us. For those of you that don't know, Clay is a professor at Harvard. He is in Silicon Valley considered somewhat of a god, having invented the term strategic inflection point. You've written 9 books around the concept of the innovator's dilemma and how challenging it is for large companies or large systems to break away from the past and take advantage of these inflection points. And you know, I think Intel and you have a long relationship. If I recall, Andy Grove famously quoted you in 1998 and talked about how the company itself was facing a strategic inflection point, and you played an important role there.
Yeah, I was coming up to a tenure at the Harvard Business School. And right when they were deciding whether they were going to let me stay or not, Andy gave that talk. And it cut the deal. So I owe a lot to Andy Grove.
Well, we owe a lot to you. Thank you. You know, your work it lives on at Intel, honestly. It's used every day in strategic planning, and as we look at choices that we have to make and how do you break away from the success of your past in order to have sustainable success in the future. And so I know that you've applied some of these learnings to various industries, including healthcare, and I was curious what you think about this idea that we're at an inflection point in healthcare. Do you think that's a correct statement?
I think we are at a point, and the question is, will we actually execute that or not? So one type of point is to use the technology to transform the products that we're making into better products. And if we spend enough technology on that initiative, you can change the business model somewhat. But if we deploy it into the market so that it transforms things that are that right now can only be addressed by the rich and the wealthy, to make it so affordable and accessible that many more people have access to it, that fundamentally changes the business model. And it's not that the first one, making good products better, is a bad idea. It's a wonderful opportunity, but it will sustain the way we're doing things now. It doesn't disrupt them.
So one ingredient then of disruption would be access, broad access.
That's right.
What are some of the other things? Like what about regulatory environments, economics, I think you mentioned?
Yeah. Let me back up if you wouldn't mind. We've done a lot of thinking about what is a business model and how is it built and what comprises a business model. We decided that there are 4 elements of a business model. The first one is a sense of what the customer is trying to accomplish in his life. We call it a job to be done. And if you understand the job, then the second element is our resources. And a company's resources include its people, its technology, its products, its cash, its brands, and so on. And then the third are processes. And I want to come back and talk about that a little bit. But processes are ways of working together that have evolved over time as we've worked together to get define how the resources get the job done. And then the fourth of the 4 elements is a profit formula that says when we have to do things, we have to get these margins, these returns, and so on. And when we're thinking about a business model and will this really change the world, we need to think about each of those four elements. And I worry that too many of us focus on resources because, again, making good products better doesn't change the model of the system at all. Processes are where I think the work that you guys are doing has the biggest impact. So that you're not plugging into an existing process, a new technology, but rather you have to change the processes so that it magnifies the impact of the new resource. And I worry about that. You know, I love Boston and I love Partners. Partners has changed my life, or not changed my life, saved my life 4 or 5 times. But they have no processes in the organization. They have administrative processes, but the delivery of care, everyone is a different case, you know. And there are other enterprises like Intermountain and Kaiser Permanente that just focus on processes. And I think we need to think about that as making this so critically transforming. We got to be sure that we don't just have the products, the resources, but we have processes as well.
So have you had experience with remote patient monitoring, and do you feel like, you led a panel earlier, and one of your panelists said the irony of access is that the people that need healthcare the most have the hardest time to actually get physical access to it because it's in a hospital, and they're either remote or they're not able to travel. What's been your experience with that?
Well, it's a wonderful technology, you know, and it can be deployed in different ways. I've had type 1 diabetes for 40 years now, and I have a device here that tells me what my blood sugar is right now, and this is connected to my wireless phone, and it calls Christine, my wife, and he calls me and says, "You jerk, you promised me that we'd keep it under 120, and
so now I understand why you didn't take me up on the candy offer backstage."
That's exactly right.
Got it. Okay, I'm less offended now.
But that's just, it's a simple example, you know, but there are other times when I've had things gone wrong where you could provide the care remotely because we have ultrasound equipment that a caregiver can do where they live and I am where I am, and they can diagnose me remotely, and it's a wonderful thing.
So I referenced the panel earlier. You had some really esteemed panelists on your fireside chat. Was there any consensus that resulted from that conversation, or key takeaways that you had?
Well, a key takeaway that I got from 3 of them is the profit formula, which is one of the 4 elements of a business model. That element is how we make money, the profit formula. And I think that those companies that have adopted value pricing their services are going to do this much faster than people who think that they can continue pay for what they do. Now, I'm on the board of Intermountain. It's a good company. And they've been pushing their patients as fast as they can to come onto the system where they pay for value. And what I observe with their doctors and nurses is once the patient is paying in that way, we give them a month or a year, then whenever those people stay healthy, they make money. And whenever, if they get sick and they get better quickly, Intermountain makes money. They lose money when the patients get sick. And here in Boston, I love Partners, but they make money when I get sick. And if we don't pick on that issue and adopt what others have already done, we can hope till the cows come home that what we're hoping for will happen, but it won't happen if we don't change the way we pay. And that's an important idea that I got out of that.
Very good. Clayton, thank you so much for joining us.
I'm delighted that I could.
We're honored to have you here. Thank you.
God bless you.
So before we looked at what perhaps some of the barriers were to adopting remote care, let's hear those same people now tell us why it's possible.
We have the stakeholders lined up, we have the bipartisan support lined up, we have the data lined up, all the technologies that are being created faster than we can use them.
So I think what you should have just heard is that the payment models that Clay talked about are changing. The behavior is changing. The technology solutions exist, and secure access is a reality. So there's really not a lot of barriers left to prevent us from adopting this type of solution. And at Intel, what we want the conversation to be about, and what we hope that we can begin that this week here at the Connected Health Conference, is really to establish remote patient monitoring as a medical standard of care. And that really, I think, can be the dialogue that can drive the industry forward together, now that we've established that the barriers don't exist. And more specifically, we'd like to be able to do this by 2020, in less than 3 years. So in order to do that, I think we should maybe take a look at how are we defining remote patient monitoring. And there's really about 38 medical conditions today that you could say qualify for this type of care. You see a subset of them listed here, and these can be delivered in a patient's home. They can be delivered in the workplace. They can be delivered in a pharmacy or a clinic. There's a variety of residential options for how many of these conditions could be monitored and treated. And so what we thought we'd do is just give you some examples. So we've got 8 of them here. I'm going to go through them quickly just to share with you what were the health outcomes, what were the business outcomes, the financial impact, et cetera, just to prove the point that the technology is real, the adoption is happening, the behaviors are changing, and the way that we'll do this is we'll talk about some of the most acute cases first, and then we'll move across to the right, which would be some of the more independent use cases. So let's get started. There we go. So Karolinska University Hospital saw a 66% reduction in readmission for congenitive heart failure patients. And as part of that effort, they simplified care protocols and boosted user satisfaction to 91% and patient engagement to 74%. Another post-acute care for the frail chronic. This was for multi-condition regimens, which drives down usually patient participation and drives up readmission rates. And in this example with Alignment Healthcare and Vivify, they were able to get a 13-point drop or a 65% decrease in their 30-day readmission with 86% compliance using this solution, which normally for these types of conditions, the readmission rate can be as high as 25%. So this was a major outcome. Also, having to stay on top of multiple medications outside a medical center is also especially challenging. At Hackensack Meridian, they used a solution where they were able to get a readmission rate drop of 20 points using a solution with Health SaaS. Also, you're seeing employers that are bringing healthcare capabilities into the workplace. I don't think this was happening in this guy's cube, but here he is going through some interesting test, and this is actually a real example with Nextera Healthcare that saw a 23% reduction in their employee base's ER utilization by being able to do routine visits in a healthcare environment provided by the employer. And not only did it deliver a lower ER admission rate, but it's actually perceived as a benefit to their employees, a convenience benefit as well as a health benefit, which has helped them with recruitment and employee retention. But these cases are not just limited to people that are already sick. Here's an example of a chronic condition treatment for diabetes. This one is with the University of Mississippi Medical Center and Mississippi's Medicaid, which partnered with Care Innovations to achieve $189 million cost savings from proactive remote diabetes management, which is a big issue in Mississippi because over half of their population live in rural areas, and diabetes is the 6th leading cause of death. So a great outcome for them. And it also works in assisted living centers. So we've seen actually that our experience is contrary to our expectation. Our expectation is that older and senior populations don't want to engage in technology, and what we found is actually when that technology brings value to them, they actually enthusiastically participate. And in this case of Spring Arbor, they had a 15-point increase in their occupancy rates, and that was the difference between them being unprofitable and being profitable. So a great outcome for Spring Harbor using a solution from K4 Connect. So it's obviously a fast-moving space. I talked about the energy that we have here at the show and the feeling that we're on the cusp of a transformation. Here's just a subset of some of the many headlines that we've seen over the last several months, where you're seeing policy momentum building with bipartisan bills getting lots of momentum. We have administrative decisions in favor of new codes that support reimbursements that are moving ahead quickly, many of which aren't even public yet. And we have new solutions recently that have been leading up to this event, including one from Intel and our partner Flex that's used to be able to deliver a platform that is agnostic to data types and agnostic to medical devices that allows any device to connect over the platform and deliver secure private patient data to their caregiver. So the rallying cry, the final plea that we have is that over the course of this week at the show, please engage in a conversation about what we can do as an industry to make remote care a medical standard by 2020. Thanks so much for your time.